Local anesthetics are widely used in dental procedures to ensure patient comfort. However, their use is not without risks. Complications can arise from the drugs themselves, the techniques used, or even from contamination. In this video, we'll explore the most common complications associated with local anesthetic use in dentistry, their causes, and how to prevent and manage them. Understanding these risks is crucial for dental professionals and patients alike, as it helps ensure safer outcomes and minimizes adverse effects. Let's begin by looking at complications arising directly from the drugs or chemicals used during dental procedures. One of the most common complications is soft tissue injury, particularly self-inflicted trauma to the lips and cheeks. This is especially prevalent in children, as well as mentally or physically challenged adults. After anesthesia, numbness can lead patients to accidentally bite their lips or tongue without realizing it. Prevention involves educating parents or guardians to monitor patients closely and discourage biting. If injury occurs, management is usually symptomatic, including the use of analgesics, antibiotics, and topical anesthetics or gels to relieve pain and prevent infection. Sloughing of tissues, or tissue ischemia and necrosis, often occurs in areas like the hard palate where the mucosa is tightly attached to bone. This can result from prolonged exposure to local anesthetic agents, especially those with vasoconstrictors. Prevention includes using the minimal effective dose and agents with shorter duration, and warning patients against applying heat to the area. Management is typically symptomatic, involving analgesics, topical anesthetics, and a bland diet. Most cases resolve within 1 to 2 weeks, but if an abscess forms, surgical intervention may be necessary. Necrosis can also develop directly at the site of injection, leading to painful ulceration. This is often related to the volume of solution injected and the duration of exposure. Patients should be warned about this risk, and practitioners should always use the lowest effective volume and avoid repeated injections in the same area. If necrosis does occur, management is similar to other soft tissue injuries, focusing on pain relief and preventing secondary infection. Complications can also arise from improper injection techniques. The use of vasoconstrictors, such as epinephrine, can increase the risk of tissue ischemia and necrosis if not administered correctly. Proper technique, knowledge of anatomy, and careful handling of needles are essential to minimize these risks. Dental professionals must always adhere to best practices to ensure patient safety and reduce the likelihood of complications. Needle stick injuries are a significant concern in dental practice, often resulting from careless technique. Prevention includes careful handling of sharp instruments, using the correct gauge of needle, and minimizing the number of needle penetrations. Prophylactic vaccination against hepatitis B is also recommended. If a needle stick injury occurs, the incident should be reported immediately, and post-exposure prophylaxis, PEP, should be initiated. Remaining calm and following proper protocols is essential for both patient and provider safety. Hematomas can develop when blood vessels are nicked during the injection of local anesthetic agents. Prevention relies on a good understanding of anatomy, using short needles for certain nerve blocks and minimizing needle penetrations. If a hematoma occurs, immediate management includes observation, external ice application, and symptomatic treatment with analgesics and muscle relaxants. Assurance to the patient is important, as most hematomas resolve without further intervention. Infections can result from contaminated needles, passing through infected areas, or improper handling of anesthetic solutions. Preventing infection requires strict aseptic technique, including preparing the injection site, using disposable needles, and avoiding multiple injections with the same needle. Management involves analgesics, antibiotics, and sometimes physiotherapy. Good surgical technique and knowledge of anatomy are essential to minimize infection risks during dental procedures. A burning sensation during or after injection can be alarming for patients. This may be caused by rapid injection, contaminated cartridges, high temperature of the solution, or altered pH. To prevent this, inject slowly and ensure cartridges are stored at room temperature. Usually, no treatment is required, as the sensation is transient and resolves on its own. Trismus, or restricted mouth opening, can occur due to trauma to muscles or blood vessels during injection, contamination, or myotoxic effects of anesthetic agents. Prevention includes using sharp, sterile, disposable needles and avoiding multiple injections in the same area. Management involves physiotherapy, heat therapy, warm saline rinses, analgesics, and muscle relaxants. In some cases, more advanced interventions may be necessary. Edema, or swelling, may result from trauma, allergic reactions, hemorrhage, or injection of irritating solutions. Prevention involves thorough preoperative assessment, careful handling of equipment, and using atraumatic techniques. If edema occurs, it's important to identify the cause. Allergic reactions require antihistamines, and if breathing is compromised, basic life support and emergency medications like epinephrine and corticosteroids are necessary. Referral to a specialist may be required for severe cases. Blanching of the skin can occur if a blood vessel is traumatized by the needle or if the anesthetic is inadvertently injected intravascularly. Prevention includes using the aspiration technique and avoiding intra-arterial administration. Blanching is usually a transient phenomenon and does not require treatment, but it's important to reassure the patient if it occurs. Persistent paresthesia or anesthesia can occur if the anesthetic is injected near a nerve, especially if the solution is contaminated or if there is trauma or hemorrhage around the nerve sheath. Prevention involves strict adherence to injection protocols and careful handling of cartridges. Management includes reassuring the patient, prescribing vitamin B1 and B2 supplements, and observing for up to 2 months. If there's no improvement, referral to a specialist is necessary. Facial nerve paresis or paralysis may occur if the anesthetic is injected into the capsule or deeper lobe of the parotid gland. This results in a temporary loss of motor function on one side of the face. Prevention relies on good anatomical knowledge and proper injection technique. The condition is usually transient, lasting only a few hours, and reassurance to the patient is the mainstay of management. Persistent or prolonged pain after local anesthetic injection can be due to improper technique, such as subperiosteal injection, or tearing of the periosteum, or the use of needles with barbs. Prevention includes using good surgical technique, avoiding subperiosteal injections, and ensuring needles are smooth and undamaged. Management is usually symptomatic, focusing on pain relief. Ischemic necrosis can result from the use of vasoconstrictors in excess or with insufficient dilution. This leads to tissue death and ulceration. Prevention involves using vasoconstrictors at the lowest effective concentration and ensuring proper dilution. If necrosis occurs, management is supportive, focusing on pain relief and preventing secondary infection. Preventing complications from local anesthetic use in dentistry requires a combination of good technique, knowledge of anatomy, and strict adherence to aseptic protocols. Always use the minimal effective dose, choose the right needle, and handle all equipment with care. Educate patients and guardians about risks, especially in children and vulnerable adults. These steps are essential for minimizing adverse outcomes and ensuring patient safety. When complications do occur, prompt and appropriate management is crucial. Most issues are managed symptomatically with analgesics, antibiotics, and reassurance. Some cases may require surgical intervention or referral to a specialist. Always monitor patients closely after procedures and provide clear instructions for follow-up care. Early intervention can prevent minor complications from becoming major problems. Local anesthetic complications in dentistry refer to any adverse events or unintended effects that occur as a result of administering anesthetic agents. These can range from mild, transient symptoms to severe, long-lasting injuries. Understanding the types, causes, and preventive strategies is essential for safe dental practice. Aseptic technique is a set of practices used to prevent contamination and infection during medical and dental procedures. This includes sterilizing instruments, using disposable needles, and preparing the injection site properly. Adhering to aseptic technique is one of the most effective ways to prevent complications from local anesthetic use. In summary, while local anesthetics are essential for pain-free dental care, they are not without risks. By understanding the possible complications, their causes, and how to prevent and manage them, dental professionals can provide safer and more effective care. Patients should also be informed about what to expect and when to seek help. Safe practice is a shared responsibility, ensuring the best outcomes for everyone involved.